welcome to the CoCoViDVid Show. My name is Cody. I will be your host today. In this episode, I'd like to just take a look at the state of cases in Manitoba and how Code Red is going for the province as a whole in general. And I'd like to shed some light on a few interesting data sources that I have come across. This is by no means a comprehensive list, so if I don't mention something here that you find interesting as well, please leave a link in the comments. Without further ado, here's some cool graphs and numbers. Yay! So this is our daily cases graph. What it does is over time, and this is since the beginning of September, plotting how many new daily cases we're getting. That red line is plotting out the 7-day rolling average of the daily new cases. Right in that area there, up in the middle, where we instituted Code Red. Like my name title said earlier, I'm not a scientist, but it looks like things are leveling out a little bit. At a very high level though, right? That's still in the about 400 new cases a day area. Into spreadsheets. I don't want to make any conclusions statistically, but this is just some simple math that I use to get a better idea of how the numbers are actually moving around and how they're growing and how things are increasing. So we got the date, we got the count, and we got this rolling 7-day average. On average, for the last 7 days, how many new cases were there every day? You with me? And then that is a day over day change of the 7-day average. How much of an increase we had for that day, for like today, over yesterday's 7-day average number. A change rate of the 7-day average. Taking that into account, I basically just, I call it, I don't know what the scientific name for it is, but it's my little gas pedal number here. So the metaphor I have in my head to try to visualize the state of our case numbers. You imagine the province of Manitoba is a vehicle, is a car that's just hurtling towards a wall. That's a little harsh. And our healthcare system is that wall. And what we're trying to do with what Lynette and her team and what everybody's trying to do is they're actively trying to move that wall away from the vehicle, farther away from the vehicle. But the vehicle is still accelerating and still moving at a alarming rate. So the gas pedal, what that actually is, it's a 7-day rolling average of the day over day change. We're still, if you imagine your foot on the gas pedal, the closer the gas pedal is to 0, the more we are throttling the gas pedal, okay? Right, you with me? Now, and that'll make more sense if I show the graph for the gas pedal. So the closer the gas is to 0, the more we're throttling. That's more than we've even just like leveled off the gas, and we're keep maintaining speed. You can see here in Thanksgiving, there was a bit of a spike, basically, right? That's where Thanksgiving would be. There's a spike. That was like we just put the foot on the pedal on the metal, and we added a lot of gas all of a sudden and had a good increase on our daily 7-day daily average. And then around the time where we were going to start pumping the gas again is when Code Red, we locked down the province and we put in the really severe public health orders. And you can see where it would have been pumped up a little bit more, it didn't. So like that's when I started visualizing that whole circuit breaker metaphor, with that term that's being used a lot by Dr. Rusin and in the press conferences, because this is also kind of like like an AC current, right? Like a power current of just like electricity being provided. And this is just kind of thrown off that pattern right there. The healthcare system's capacity is this wall that the province is hurtling towards, and Lynette and her team and everybody in the Manitoba healthcare system is trying to move this wall. Then what we need to do as a province is let off the gas a bit here. With that in mind, I'm also here taking that 7-day average and for calculating the doubling rate. And the doubling rate in this case means how many days it will take the 7-day average to double. If there was a doubling rate of 1 day, that means if there's 400 cases, but based on our gas pedal rate, tomorrow we might have 800 cases. So that would be a doubling rate of 1. So lower the number, the worse it is. And you can see, again, at one point it got down to 7.6 days. So that would kind of be like at how much gas we're giving it. A week from now, we could have a double our 7-day average. You can see us just like putting on the gas, letting off the gas, putting on the gas, letting off the gas. And then again, code red came, and that kind of just threw off the whole pattern, and we're starting to let off the gas now. So whereas a positive number in this case is how many days it would take to double, a negative number would be then how many days it takes to halve. So at some parts when we've let off the gas in between those periods of a lot of gas, it would take, for example here, 63 days for our 7-day average to then halve. But as it is right now, and as you can tell from the graph, it's more that we're throttling the gas and we're keeping at a consistent rate. And that means flattening the curve. That's what we mean when we're saying flattening the curve, is taking the rate of how much gas we're giving and then letting off the gas so that we're not actively accelerating towards the wall. But we need to put on the brakes. So what this doesn't show is that we put on the brakes in any way yet. We are throttling the gas, we need to let off the gas, and we need to ideally put on the brakes. So everything that I've shown you so far is based on publicly available numbers. And that brings me to the next thing I want to talk about here. Because there are so many different teams and groups of people whose job it is to put together this information and put it out in the public, it can be very difficult as a member of the public to know where any of this information is. It's kind of scattered all over provincial government websites, not to mention Canada-wide as a whole. Finding all that information across provinces, even just within Manitoba, there's just a lot of resources, and it can be very confusing. And that can lead to a lot of misinformation and often mistrust in the province. But as an old co-worker of mine used to say, do not attribute malice to what can be attributed to inability. First up, I'm going to talk about the province of Manitoba's COVID-19 updates dashboard. And this is probably the one you will have most likely seen before, or at least seen news articles that have referenced the numbers available on this dashboard. And what it basically is a high-level overview of coronavirus cases in the province so far. So, for example, you can see right there, it's total number of cases, new cases today, test positivity rate, and the number of deaths in the province to date. If you scroll on down, you can take a look at a larger dashboard by selecting one of these health districts. So, for example, hitting all of Manitoba will bring you to this page, which you can use then to see a lot more in-depth information. And you can filter along the top by the different regional health authorities. For example, Winnipeg, and that will update some of the numbers you see there to be specific to Winnipeg. In addition to that, you could zoom in on this map. If we have Winnipeg selected, for instance, you could zoom in on this map and get district level numbers by clicking on, say, St. Boniface, and that'll give you the latest update for that district. So up next, I want to take a look at the Government of Manitoba's Epidemiology and Surveillance Unit's weekly report. So on this page, you can see a lot of high-level epidemiological data and information. So it covers things like where outbreaks have been declared, cases, overall cases, severity of cases. So that's like how many are in the ICU versus hospital. Exposure kind of shows where some cases are coming from. Symptoms, I don't know, a lot of interesting data that has to do with the spread and the contraction of the virus. Including under severity, you can take a look at underlying illnesses right there. And that gives a bit of a breakdown on underlying conditions that contribute to whether a patient was hospitalized or not. There's tons of them that are very interesting that you can scroll through and take a look at. And I just invite you to look at that data a little bit more closely as well, because it provides a lot of insight into what type of people are being affected, what type of people are being hospitalized, who's contracting it, that kind of thing. Again, this is a weekly report. So if you scroll on to the bottom of this page here, you can see the report, same report for any previous weeks. Next up, I want to take a look at the list of school and childcare exposures. On this particular page, there is other exposures that are reported, including bus routes, etc. But of note that I wanted to at least talk about specifically was the school and childcare exposures. I know I've seen that come up in the conversation a little bit. I believe this is a Winnipeg specific list, so it's only for school divisions within Winnipeg. You can see every letter that's being sent out for the school divisions regarding potential exposures identified at schools. I'm recording this on the 3rd, and you can see letters that went out on the December 2nd. So it's fairly up to date in terms of the letters that are being sent out. And then the dates and time, there is the dates and times of the potential exposures that parents are being informed on. It's also important to note that these are also potential exposures. Essentially, they are notices to parents that a child in that school division or that school tested positive for COVID-19. And it doesn't mean they got it from the school. It just means that a student in that school tested positive. So that's important to also consider. Anyway, that's another quick one. Like I said, there's other stuff on this page regarding other potential exposures that are also very interesting. Last up, the federal government of Canada's COVID-19 data visualizations page. On here, you can take a look at the country as a whole and the high level. It's kind of like that Manitoba dashboard I showed you earlier, but for the entire country. And you can see it mapped out in terms of total cases. This table is particularly interesting to me. So you can compare Manitoba to other provinces in the country in terms of cases and testing. Here you'll want to take a look at the rate, and the rate, all the rate columns will be based on population. So you can see here in Manitoba, we've done about 351,000 tests. The rate is based on per million people in the population. So yeah, we're doing on a rate of 256,000 per million people in the population in Manitoba. And that kind of compares pretty closely to like, this one's Quebec, I believe. Saskatchewan is a little bit of a lower test rate, but yeah, you could take a look at it and get a good idea of how many people in the province are going out and getting tested. So that's it. That is just a few sites that I found interesting and I thought I'd bring your attention to that shed some light on COVID-19 data at a provincial and national level. And I just wanted to bring those up because there's, like I said at the beginning, there's tons of resources available, but they are admittedly very difficult to find because so many disparate organizations are putting them together and putting them out there. So if you have a link that you think is interesting as well that I didn't cover here, or maybe you're on a team that is working on a reporting of some kind that you believe should get some more exposure as well, leave a link in the comments or send me an email at cody@cocovidvid.com. And if you're watching this and you like this, hit like. And if you want to see more content like this, hit subscribe. And hopefully I'll be back next week with another interview for you guys. Thanks for watching. See you next time.